When a person is diagnosed with cancer, it's obviously a devastating diagnosis. There can be a lot of anxiety, fear, and confusion as to how to proceed with getting treatment. I think the most important thing is to establish yourself with a comprehensive cancer center that's going to provide a range of services for you and your family, and to maintain good contact with your primary care physician. The first step in dealing with cancer is establishing the correct diagnosis. And the way to do that is to get a good physical examination, have a good discussion with an oncologist, a surgeon, or your primary care physician, and then determine if a biopsy should be performed of the area of concern, or if you should have a body scan or some type of imaging to see what the size of the tumor is, the extent of the tumor, and then to assess what would be the most appropriate area to biopsy. I think it's also important to recognize that other medical issues may complicate your cancer diagnosis or treatment, or that cancer itself may complicate your other physical conditions, such as high blood pressure, diabetes, or heart disease. So it's important that you be approached as a whole person, not just a person with cancer, but as a person that may have other medical challenges, social challenges, and physical challenges as well, such as disabilities. Once you've been assessed with a good physical exam, you've had some imaging and a biopsy has been performed confirming the diagnosis of cancer, the next step is to stage your cancer. This gives us an idea as to how advanced your cancer is and what might be the treatment options available to you. Increasingly, we're also doing special testing on your tumor to determine if you're eligible for certain radiation or chemotherapy treatments that are specific for your cancer, and which may be associated with better control and outcome for you. Patients often ask if they should get a second opinion or go to a tertiary cancer center such as Stanford or UCSF for a second opinion. And we always support a patient in their decision to pursue a second opinion. But understand that time is very important when you've been diagnosed with cancer, and that while a second opinion is a very important part of your treatment, we also want to ensure we can get that second opinion in a timely fashion so that we don't delay your diagnosis and treatment. Once you've been diagnosed and you've been staged, the next step is to decide on the best treatment course for you, as well as to attend to your other medical conditions which might be affected by your cancer and treatment, pain control, and also attending to some challenges that might be involved with getting treatment, such as social issues like working, disability income, transportation, child care. If you're a caregiver, who's going to take care of your loved ones while you're getting treatment? Do you need a caregiver yourself? Do you need physical therapy, occupational therapy? Are you going to need rehabilitation after surgery? These are all important issues that we need to plot out and plan for so that you can maximize your recovery and get on to treatment as soon as possible.